Imagine waking up one day to find that your health insurance premiums have skyrocketed. Or worse, you've lost your coverage altogether. This is the stark reality that millions of Americans may face if the Affordable Care Act, ACA, subsidies are not extended. But here's where it gets contentious. Democrats are standing firm on their demand that these subsidies be continued, while Republicans are refusing to budge. The Senate Democrats recently voted down a House-passed stopgap bill to fund the government, citing their unwavering commitment to extending the ACA subsidies that are set to expire at the end of the year. This move has sparked a heated debate, with Democrats arguing that the subsidies are essential for maintaining affordable health care for millions of Americans. On the other hand, Republicans are adamant that they will only support a clean extension of government funding, free from any additions, including the ACA subsidies. But what does this mean for the average American? Let's break it down. The ACA subsidies have been a lifeline for many individuals and families who struggle to afford health insurance. Without these subsidies, premiums could increase significantly, making it difficult for people to access the health care they need. And this is the part that most people miss. The ACA subsidies are not just a partisan issue. They have real-life consequences for people's health and well-being. The controversy surrounding the ACA subsidies is not just about politics. It's about people's lives. As the deadline for government funding approaches, the stakes are high. If a continuing resolution is not passed, federal departments and agencies will be forced to curtail operations and furlough workers, which could have far-reaching consequences. Senate Majority Leader John Thune has made it clear that he will only support a clean extension, while Democrats are insisting that the ACA subsidies be included. But here's the thing. Democrats are not just asking for the subsidies to be extended. They're demanding that Republicans negotiate with them to find a solution. As Senator Chuck Schumer pointed out, when Democrats were in the majority, they were able to avoid a government shutdown by working across the aisle. So, what's different this time around? The answer lies in the politics of the issue. The ACA subsidies have become a polarizing topic, with each side refusing to give in. But as the clock ticks down, it's essential to remember that this is not just a game of political chicken. It's about people's lives. In other health-related news, a federal advisory panel has been debating changes to the Centers for Disease Control and Prevention's vaccination policy. The Advisory Committee on Immunization Practices, ACIP, voted on a recommendation for the combined measles, mumps, rubella, and varicella vaccine. But the most controversial aspect of the proposal was left for another time. Meanwhile, the Food and Drug Administration has issued a recall for several brands of cinnamon due to elevated lead levels. And in a surprising move, a federal vaccine advisory panel voted to recommend that people consult with a clinician before getting a COVID vaccine. As we navigate the complex world of healthcare, it's essential to stay informed. But here's the question. What do you think about the ACA subsidies? Should they be extended, or do you think they're unnecessary? We want to hear from you. Share your thoughts in the comments below. And if you're interested in staying up to date on the latest health news, be sure to check out our newsletter. We'll keep you informed about the latest developments in the world of healthcare. So, what are you waiting for? Join the conversation, and let's talk about the issues that matter most to you.